In this lesson, we will cover what targeted therapy is, how it differs from traditional cancer therapy, what the benefits and limitations are. We will also describe a few common types of targeted therapy and how they are used in cancer care. So, what is targeted cancer therapy? Targeted cancer therapy is a treatment that focuses on specific molecules or pathways involved in cancer growth. How does targeted therapy work? These therapies are designed to identify and attack specific cancer cells based on their molecular makeup. For example, some cancer cells have certain proteins or genes that drive their growth. Targeted therapies can block their activity and stop the cancer. An essential part of developing targeted therapies is understanding biomarkers and genetic mutations. Biomarkers are like the fingerprints of cancer cells. They help identify the specific type of cancer and how aggressive it might be. By studying these biomarkers, scientists can develop drugs that specifically target them. Genome sequencing is a molecular pathology technique that plays a crucial role here. By sequencing a patient's genome, doctors can identify the genetic mutations driving the cancer. This information is then used to select the most effective targeted therapy for that individual. You might wonder, how is targeted therapy different from personalized medicine? Targeted therapy is actually a part of personalized medicine. While targeted therapy focuses on attacking cancer cells based on specific molecular targets, personalized medicine is broader. It involves tailoring the entire treatment plan to the individual patient's unique genetic makeup, lifestyle, and environment. Targeted therapies come in different forms, and each one works in a unique way. Let's briefly learn about 3 examples of common types of targeted therapy. Monoclonal antibodies are lab-made molecules that can bind to specific targets on cancer cells. Monoclonal antibody therapy is used to treat HER2-positive breast cancer. HER2 is a protein on the surface of breast cells that can make them grow quickly when there is too much HER2 activity. An antibody targeting HER2 can bind to these cancer cells and block their growth. Next, we have small molecule inhibitors. These are drugs that can enter cancer cells and block the enzymes and proteins that cancer cells need to grow. A well-known example is imatinib, a tyrosine kinase inhibitor used to treat chronic myeloid leukemia by blocking the BCR-ABL protein that causes the cancer cells to grow uncontrollably. Lastly, let's briefly touch on immunotherapies. Cancer immunotherapy is a targeted therapy that helps your own immune system fight cancer. One example of cancer immunotherapy is the use of immune checkpoint inhibitors. Normally, cancer cells can hide from the immune system by turning off the immune cells that recognize them. Checkpoint inhibitors provide a boost to certain immune cells and help your immune system to recognize and attack cancer cells. Targeted therapies offer some significant benefits over conventional therapy. They are highly precise, meaning they can attack cancer cells while sparing healthy ones. This leads to fewer side effects compared to traditional therapies. For certain cancers, targeted therapies have shown improved outcomes, offering hope to many patients. However, they're not without limitations. Cancer cells can develop resistance to these therapies over time, making them less effective. Additionally, targeted therapies are not universally effective. They work best for cancers with specific molecular targets. Finally, the cost of these treatments can be high, posing a challenge for many patients. In summary, targeted therapy represents a significant advancement in cancer treatment, offering a more precise, personalized approach. But like all treatments, it has its pros and cons. Understanding these can help you or your loved ones make informed decisions about cancer care. Thanks for watching, and if you found this video helpful and would like to view more, please take a look at our online library.